completely full screen so we can see the whole thing. But all right, so this is my presentation on bleeding control, for medical terms, hemorrhaging control. Today we're going to be talking about different ways that you can stop someone from bleeding, whether that's with a Band-Aid or our highest level of bleeding control would be basically a tourniquet. Otherwise, we would go medical route or a chemical route with something like a TSA. But today we're just going to be talking about physical ways that we can stop hemorrhaging. So in our table of contents today, we're going to be having our intro. I'm going to introduce you into the medical term as to what is bleeding control or what is hemorrhaging. We're going to talk about the hemorrhaging devices that we can use, again, such as Band-Aids, quick clot, even cold packs and stuff like that we can use to help stop bleeding. The effects of hemorrhaging, and then we're just going to summarize it. If you guys got any questions, let me know. There'll be a couple scenarios in here. I'll try to get you guys engaged with that by asking you a couple questions off that scenario. And then you can give me examples of how you would help in those scenarios to control the bleeding. All right. So, what is hemorrhage control or bleeding control? It's a critical aspect of emergency medicine that we use today to help control bleeding in traumatic situations. Uncontrolled bleeding definitely can lead to worse situations. You could go from a type of shock like compensated to a decompensated shock, just by losing a lot of volume of blood. And with that being said, the average adult carries about 5 to 6 liters of blood in their entire body, and in the child, there's 1 to 2 liters depending on their size. Again, today we're going to discuss different ways that you can control the bleeding and ways that are definitely more effective in different situations. All right. So the importance of bleeding control cannot be overstated. Rapid intervention can prevent significant blood loss, which is important for maintaining blood pressure and oxygen to vital organs. So that was a part of that compensated and decompensated. So when you have compensated shock, you'll have a lot of people who are still perfusing blood. Their blood pressure is up, it's looking good, but you can tell that something is going on, but obviously by the way they're bleeding. I'll use a gunshot wound to the leg. Our legs are pretty big muscles. We have big muscles in our legs, and if we get shot in our leg, we're going to lose a lot of blood. So there's only a certain amount of time where you'll stay in that range of what's called compensated shock before you go into decompensated shock. And when you go into decompensated shock, that's when you're going to lose a lot of that oxygen and nutrients that are being delivered to the body, and then you're not going to be able to, trying to think of the word here, you're not going to be able to perfuse those vital organs that are needed. So if you can't obviously get blood to the heart, your heart's gonna not pump blood or pump enough blood adequately, and then you're gonna have complications there, as well as the brain. If you can't get enough oxygen and blood to the brain, you're gonna have complications with your patient at that point. So rapid intervention can prevent that significant blood loss, which is essential for maintaining blood pressure and ensuring adequate oxygen is being delivered to those vital organs. Effective hemorrhage control techniques such as like applying a Band-Aid, and then you can do things like applying direct pressure on certain things, and then there are certain things that we can't apply direct pressure to. So we're going to utilize tourniquets and employing hemostatic dressings. Things like that can bring your patient back to maybe not homeostasis, like a point of them being at par, but it can definitely help you control the situation a little bit better and keep your patient alive. So survival rates and traumatic injuries are, there's a typo there, are definitely based off of how quickly you are able to intervene and use the right things within that intervention. So like with a gunshot wound, I definitely wouldn't use a Band-Aid or anything like that. I would try to plug that hole with something like a quick clot, which comes out kind of like in the form of a Z, and you kind of feel that hole there. There's a lot of different ways. I know in the military they use different types of hemostatic dressings as well as like quick clots. There was one even where they fill gunshot wound holes with like a tampon like substance or something like that. I don't know, Joe, if you guys still use
These tampons, yeah.
Yeah. So basically, like you take it, looks like a long bullet. You put it inside the cavity and you release it, and then it uses the blood and it uses chemicals that are on that pad to swell up and clot the blood. So that's one way. So recognition and response to bleeding can not only save lives, but it can also enhance recovery times, making this a fundamental skill for both medical and first aid professionals to utilize. All right, and I got a quick tip there. Just saying the average blood loss due to traumatic injury is about 750 milliliters. All right, addressing bleeding swiftly and effectively is essential in preventing complication and showing the best possible chance to survive. We will discuss today, again, techniques for hemorrhage control and the types of hemorrhaging for you guys to go over. Again, so if you have a cut to your forearm versus a cut to the throat, we're obviously going to treat it different and understand why we're treating it different. Like I wouldn't use a tourniquet to put a cut over, somebody's neck, because obviously we might fix one thing, but we might create another problem there. So we might stop the bleeding, but now we got a airway issue there. So just knowing what type of device you want to use in the situation is going to be great. All right, so again, we're just going to be getting you more familiar with understanding the importance of hemorrhage control. All right, so we're going to talk about our devices here. The biggest one that everybody knows about is the tourniquet. So what is a tourniquet? It's a medical device, typically a strong binding with a tightly windlass. So if you're not familiar with the tourniquet, these are one-time use. So on this, it has the windlass, and then it also has the strap. So it'll come like this. They might come in different colors. A lot of the times they like to use like bright colors, orange, lime green, sometimes black with red windlass on it. And what you want to do is you want to take this, you're going to pop it out, you're going to wrap it around your patient, and this is going to be used for more severe cases. So we're going to talk about somebody that's missing a limb, or somebody that has a gushing gunshot wound. You can definitely use this. You always want to go above the site, so never below. So if they have a gunshot wound to the leg here, you want to go just above the site. You're going to strap it around. You're going to tighten that windlass all the way until the blood stops. One thing of importance to do with this tourniquet is to write down the time that you tied it down. Once you tighten it down, you use a little marker. You can just jot down the time right there. If you could jot it down on the tourniquet itself, that's great. If you could put it on a piece of paper, that's great, but you're most likely going to be in a chaotic situation. So writing it on here is great, because the next person that comes along is going to reference that time to say, hey, this has been on here for 5, 10, 15, 20 minutes, or however long it's been. So with that being said, this is going to be used for patients with severe bleeding from a limb that cannot be controlled with direct pressure. Again, to use this, you're going to open the strap, position above the bleeding site, pull the strap tight until the bleeding has stopped. And you're going to do that again by tightening up this windlass knot here. All right. So we got our hemostatic dressing. So hemostatic dressing is not just one type of dressing. They come in all different shapes and sizes. So if you have a trauma bag, you have a lot of different hemostatic dressings that you can use in there. Some can be used for like smaller cuts, scrapes, burns, and things like that. And some of them can be used for things that someone may need stitches or something like that for. So again, the nice thing about these is that they come with a clotting agent that's impregnated into the material, so it helps stop the bleeding. So like what I was talking about, the tampon thing that the military uses, it's like coated or dipped in some type of clotting agent that helps you clot further. And the reason why that they use that clotting agent, because you may come across somebody that deals with some type of bleeding disorder, like a factor V or something like that, or they're just simply on blood thinners. So that could, if you just try to do it with a napkin or something like that, it really won't get the job done. So this particular hemostatic dressing would function within 60 seconds. And the type of patients we're going to use that for, we're going to use that for patients with severe bleeding that cannot be controlled necessarily by direct pressure. So you can use this by wrapping it around. You can use a little bit of Coban to help wrap that around there too, and just create more direct pressure with that. Or you can even use it as a way to stuff it inside of a cavity that is oozing a little bit, and you want to control that bleeding a little bit more. All right. And then we'll just go with our simple direct pressure type of dressing. So our direct pressure type of dressing can be something as simple as a Band-Aid, because you're applying direct pressure with that. And it's not going to be necessarily used for people that have that are severe. So these are going to be patients who are like mild to moderate bleeding. Again, something where you pull up on scene, they might have a cut to their head. It's not really bleeding, but it's open, and you just want to protect that area from anything else getting in there, debris or whatever the case may be. So you might irrigate it a little bit and then put some direct pressure on that, wrap it again with some Coban or something like that, just to make sure it doesn't go anywhere, or you can even tape it down. So this would be our more everyday, like your kid fell down on the playground, scraped their elbow, worst case scenario, someone may need stitches or something like that. So again, you can use simple gauze with this and just wrap it up a little bit. All right, so quiz time right here. This is my guy Alberto. Alberto was playing soccer in the backyard barefoot when he cut his foot on a piece of glass. He has good CMS and a laceration which is about 1 inch in length and 1 inch in width. Which type of hemorrhage control do you guys think he needs? Direct pressure, hemostatic dressing, or are we going full tourniquet with this one?
Just direct pressure.
Direct pressure? I think that's good.
I think that's the same, yeah.
Direct pressure? Yep, I'll go with direct pressure. Most of the time, like I said, these cuts at worst, piece of glass, unless it's a huge window shard or something like that, he's gonna need stitches at most on his foot, wherever it may be. If he were to be missing like a toe or something like that, then we could be talking about possibly a tourniquet. But most of the time with those cuts, you would use hemostatic dressing, and then you would just wrap it or something like that. Something like that would definitely stop bleeding once you use a quick clotting agent on top of that. All right, so we got our next guy. This is Marcos. He was stabbed in the abdomen outside the courthouse. He placed a knit hat over the site, but it's bleeding through. What type of hemorrhage control do you think this guy needs?
Same thing, direct pressure with some sort of clotting agent in there maybe.
Yep, I think that would be good. We wouldn't use a tourniquet. Obviously, our tourniquets don't stretch that wide. We wouldn't go across the abdomen. And if we were to have one that would wrap around his abdomen, we would worry about harming his thoracic cavity or something like that, or potentially harming his diaphragm or his abdomen, the other vital organs that are in there as well. We could squish those, and that wouldn't make for a great time. So yeah, possibly stuffing it with some type of hemostatic dressing, and then holding direct pressure, or even wrapping his abdomen with some Coban will work as well. All right. So we're gonna talk about some adverse effects here of hemorrhaging. All right. So again, uncontrolled bleeding can lead to a range of serious consequences. In this section, we will discuss how things like hypovolemic shock, organ damage, and or blood or disorders like coagulopathy, don't shoot me for saying that one, may affect the outcome of a patient experience due to hemorrhaging. All right, so we're going to talk about the main one, hypovolemic shock. Hypovolemic shock is loss of volume. So this person is losing blood, they're losing blood fast, and this is a condition where the body loses a significant amount of blood, leading to a decrease in blood volume and inadequate flow to the organs. So again, we want to make sure that we're perfusing those organs so our patient stays alive. Our job is to get them to the hospital alive, and we don't have the tools necessary we don't do blood transfusions. So we got to do what we can by keeping this patient alive and keeping his organs perfused for as long as possible. So you're gonna have some symptoms like a rapid heartbeat, a low blood pressure. They're gonna be confused and they're gonna have weakness. The reason why they're having a rapid heartbeat is because their blood is not, their heart is like, hey, I'm not getting a lot of blood circulating to these organs, and my body is demanding that my heart speeds up so I can get more blood to those organs, which in return, you'll see on your monitor, you're gonna have a low BP, and as far as presentation with the patient, they're gonna be confused and weak. Obviously, they're gonna be confused because there's no blood getting to that brain, and they're just starting to lose their GCS is starting to go down, their ANO status is starting to be affected by that as well. All right, if left untreated, it could definitely lead to organ failure and or death. All right. Coagulopathy.
Coagulopathy.
It's a condition where the body loses a significant amount of blood and it doesn't have the ability to clot. So this is one of those clotting issues that you can run out to in the field. Grandma fell down. She got a goose egg, but it's split open, and she's just gushing blood. No matter how many times we try to stop it with the gauze, it's just not working. So things like that affect that would be like a factor 5, factor 6, or blood thinning medications can really play a part into this patient losing so much blood. So you will see things like subcutaneous bleeding. So you'll see bleeding underneath the skin. You'll see bruising on the skin, which was just old pooled blood. And they'll have a history of medication or clotting disorder. So again, you'll come across your typical Grammy who fell down, and you go look in her medicine cabinet, and she has these lists of blood thinners that she's taken, and she'll probably mention to you, hey, I got this blood disorder where my blood acts funny or something like that, and it just won't clot. Those type of people, we definitely want to take even something like a standing fall serious, because they can have that subcutaneous bleeding, and they can have that intracranial bleeding, which can lead to things like intracranial pressure buildup, which can make them confused. They'll have like wacky blood pressures and things like that. One of the other things is if you ever do an eye test on a person with ICP, they'll have one blown pupil and one just normal looking pupil, and they might just be talking a bunch of gibberish. So it might present as a stroke to you at first, but then once you do a little bit of digging on the history, you'll realize like you might be dealing with some intracranial pressure, and there's a lot of pressure that's building up on their brain, causing them to be confused, and they might not be perfusing blood to their vital organs. So again, if this is left untreated, it can cause organ failure and or death. And that moves me on to internal bleeding. So internal bleeding is obviously exactly how it sounds. It's a condition where pain and swelling may be localized mainly to the abdominal area, because that's the biggest open cavity that we have on our body is our abdominal area. Even though we have a lot of organs in there, there's still a lot of space in there to play around. And if there's some type of injury to the abdominal area, and the person is a little bit confused and things of that nature, and there's like, what is it called? Cullen's. They might have a Cullen sign, which is usually like a C around the belly button, and it makes it look like bruising around there. And that's a very big sign for internal bleeding. So that blood likes to pool, and it's just going to go down. It's just going to sit around that belly button area. So you'll see some bruising right there. They might be tender to the touch. There'll be definitely swelling, and there'll be some guarding. You might touch over there, and they just might guard, and that's a telltale sign that they have some internal bleeding. So again, yeah, it's usually accompanied by tenderness and rigidity. Your usual symptoms that you're going to see You're going to see the subcutaneous bleeding, bruising on the skin, and most of the time these people are going to have like a list of medications that are like blood thinners and stuff like that, as well as probably some clotting disorders. So with that, you'll see like weakness and fatigue. A lot of the times when a weakness, if it's not a traumatic injury and they're just having some type of internal bleeding, what'll end up happening is they'll have like coffee ground like poop. So if you see that and it's coming out dark, it's usually a higher up GI bleed or something like that. But if it's coming out super bright red, it's probably a lower GI bleed. And again, these patients are always on some type of like blood thinners or they got a clotting disorder. So again, if you leave it untreated, organ failure and or death. So in summary, hemorrhage control involves methods like direct pressure, tourniquets, hemostatic agents, and even surgical interventions. Symptoms can be something as simple as, there's visible bleeding there with something we can see on site, or there's something internally going on that we just can't tell. And a big thing you want to lean on at that point are how's that patient presenting? What are you seeing on your monitor in terms of blood pressure and things like that? And then you also want to make sure that you want to check their history, their medical history. If they're big on taking blood thinners or they have a history of like a clotting disorder, that's something you definitely want to take into consideration when dealing with patients who have hemorrhaging issues. Additionally, like I said, things like hemophilia and thrombocythemia complicate hemorrhage management because those are the clotting factors that are going to basically fight them not to clot. And that was the other thing. Patients who are, they'll say, I take an INR. You might go in the house and they say they fell down and you might see some bruising on them or something. And they say, hey, I just did an INR and it was 1 point something or something like that. That for patients like that, that's actually a bad thing. So if they say 1 point something, 1.2 to 2.2 is actually kind of bad. Most of our patients that are on blood thinners, they do an INR and it might be in like the 2.7s to the 3 point somethings. And the INR is basically a machine that tells you how thin your blood is running at that point. So the thicker the blood for them is obviously bad because they've obviously dealt with some type of heart issue or something like that. But the thinner it is, it'll be in that higher like 2 point something range and yada yada going up. And that's where you want to be. But for us, that's just a telltale sign, a red flag. Hey, this person fell down, they're bleeding. We know they're on some type of blood thinner. You're talking about INR and all that good jazz. So that's another thing to be looking out besides medical history. They'll let you know if they do INR treatments or they check their INR. So again, just emphasizing the point that we need to do a careful assessment, and once we get on track as to what we believe needs to happen, we need to act quick on it because again, it only takes 750 milliliters for a person to lose a significant amount of blood before they start showing signs of like decompensated shock. And at that point, we're in a whole nother realm, and we're probably going to lose our patient. So hopefully this presentation brought some things to light for you guys as to how even like a small fall can turn out to something bigger, and different ways we can apply our dressings and tourniquets and things like that to help save our patients. I did bring in a few representations for you guys. Again, I know I've held up the tourniquet here, which is the one everybody's really familiar with, but on your job there are different things you can use. Like we even have this trauma dressing. This trauma dressing is great. You can use it for a lot of things, like you have your big gashes upside the head. You can use it for that. This is one of the ones that has some of them do have the clotting agents on them. Some of them don't. So it's up to whoever's in charge of ordering your products as to which ones they prefer. Most of the time people choose the ones that have the hemostatic clotting agents in it. and those work out pretty well. We do have ABD pads as well. These combine ABD pads, which are great. You can use those to stuff things like big gashes that are maybe oozing, and you can use those as well for like getting in those nooks and crannies where somebody might have a good gash in their eye, and that the gauze won't do it because it's not going to stop bleeding in those very vascular areas, but it definitely will. That will work for it, and that's small enough that you can kind of cut it, pack it, and roll it around the person's eye or in those weird areas. All right, so we were talking about things to deal with gunshot wounds. These are great right here. You can take these out; they fold like a Z or something like that, and you can literally stuff it into the hole. And then what you want to do after that, you want to take some type of dressing to wrap it. Usually Coban is a good way to keep this intact. And then we can use something as simple as like an ice pack. One thing I didn't talk about was nosebleeds. Nosebleeds are definitely one of the ones that can get pretty messy. A lot of people tend to want to throw their head back, but you definitely want to have your patient lean their head forward, grab an ice pack, and then we do carry either these nose clamps here, which sometimes work, sometimes don't. It's always like patient dependent. But one thing that I found really worked out was the ice pack. And the reason why the ice pack works out great is because it actually shrinks the blood vessels in the nose. So applying that cold makes them shrink, stops the bleeding. And then we can do something as simple as for like surface or skin cuts. You know, somebody sliced their hand or something. It's not too deep. You can use a gauze, place that over it, something that's like a little scrape, and tape it up with that. And then again, our conforming gauze is great too. If you have something big cut that doesn't necessarily, it's kind of oozing or something like that, that conforming gauze works good as well. It doesn't have the clotting agents on it like our ABD, but it can get the job done if the patient pretty much has controlled bleeding or anything like that. So again, thank you for your time. Hopefully this was informational for you guys, or it did you guys some justice, and that's it. Man. There you go. This is live on not teeth.
So I'm gonna stop it for you.
Yeah.